Hey, welcome back to Not So Complicated, and today we'll be talking about RAS simplified in such a way that you will never forget it again. Alright, through a simple cheat set. Let's begin without further delay. So, RAS. So, you have to ask a question first. So, is it raised or not raised? So, it can either be raised or not raised. If the RAS or lesion is not raised, then it is macule. But if it is raised, then we have to ask another question, that is the content solid or liquid? So either it can be solid or liquid, alright? So if the content is solid, you have to ask another question, that is, what is the size of the lesion? So there can be two options, that is less than 1 centimeter. If the size of the lesion is less than 1 centimeter, then it is papule. And if the size of the lesion is more than 1 centimeter, then you have to ask another question here. So the question is, what is the shape of the lesion, the top of the lesion, alright, the shape of the top of the lesion. If it is flat top, that is a plaque, and if the shape is dome, that is dome shaped, then it is a nodule. And if the lesion has a stalk like appearance or projection right there, so it is a papilloma, alright. So that is how we wrap it up in solid content. If the content is liquid, we have to ask another question again, that is, what is the size of the lesion, just like in the solid one. So if the size is less than 1 centimeter, then that is a vesicle. If the size is more than 1 centimeter, then that is a bulla. Alright, so if the lesion is yellowish color or post-secreting, then it is called pustule. So that is how we wrap it up. That is very crystal clear, isn't it? So let's talk about the appearance and wrinkle. The first one right here is macule, then the papule, then the plaque, then the nodule, then papilloma. You can see the little projection there like a stalk. You can see the vesicle. Bulla, it is very crystal clear, and pustule, you can see the yellowish color there. That is all. Please subscribe for more, and thank you.